Everybody, and welcome to this week's Grand Rounds. I'm Dr. Stuart Harmon, the Program Director for the Pediatrics program, so I am honored to be the person introducing the speakers today, three of my outstanding PGY3 residents. I will start by doing the land acknowledgement. Ottawa is built on unceded Algonquin and Anishinaabe territory. The peoples of the Algonquin and Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. CHEO also honors all First Nations, Inuit and Métis peoples, and their valuable past, present, and future contributions to this land. Now, the presenters that we have today are Dr. Vesa Basha, Dr. Virginie Bleau, Dr. Sharon Ding, and Dr. Julia Hunter-Schouela. I'll read their bios for you in case you don't already know them from your many interactions you might have with them if you are on the ward or managing any service, since they rotate through everything. Dr. Vesa Basha completed her undergraduate degree at the University of Ottawa and received her medical degree at McMaster University. Her mindfulness activity of choice is meditation, which I think will be very interesting, because often when you try to explain mindfulness to people, you might sometimes try to shorten or simplify the explanation as calling it mindfulness is the opposite of therapy. So it's going to be great to have this kind of explanation to help us have a more fuller understanding of what we mean when we say mindfulness. Dr. Virginie Bleau completed medical school at McGill, and after completion of her third year in pediatrics is going to be going on to subspecialty training in nephrology at the University of Ottawa. Virginie is most mindful when she runs. Dr. Sharon Ding completed her undergraduate degree at McGill and received her medical degree at the University of Ottawa. Sharon's favorite mindfulness activity is doing yoga. Dr. Julia Hunter-Schouela attended Queen's University for her undergraduate degree in mechanical engineering, then went on to medical school at the Royal College of Surgeons in Dublin. Julia is most mindful when cycling. The title of their presentation, as you can see on the screen, Mindfulness Meets Medicine. And with that, I'll let you take it away.
Thank you, Dr. Harmon. Good morning, everyone. Thank you for attending Grand Rounds. So our presentation, as mentioned, is Mindfulness Meets Medicine. We have no conflicts of interest to disclose. The objectives of this presentation will be: number one, to understand mindfulness; number two, to review the pertinent literature regarding mindfulness in medicine; and three, to provide recommendations to incorporate mindfulness into your routine as a medical provider. First, let's take a minute to just inhale, feeling the chest rising, pausing, and then exhaling gently, and pausing at the end of exhalation. So if you were able to do this, you just had a mindful moment. So let's first look at objective number one, which is understanding mindfulness. So what is mindfulness? Mindfulness means maintaining a moment-by-moment awareness of our thoughts, feelings, bodily sensation, and surrounding environment through a gentle, nurturing lens. Mindfulness also involves acceptance, meaning that we pay attention to our thoughts and feelings without judging them, without believing, for instance, that there's a right or a wrong way to think or feel in a given moment. When we practice mindfulness, our thoughts tune into what we're sensing in the present moment rather than rehashing the past or reimagining the future. This can lead to a better understanding of oneself and the surrounding environment. So as we know, stress is quite prevalent in the medical community. There are long-standing stressors such as long work hours, night shifts, witnessing the pain and suffering of our patients, caring for patients with life-threatening disease, and the culture of perfectionism. There have also been some emerging stressors, especially with the pandemic, such as staffing shortages, an increased number of complex patients, dynamic changes in technology and regulations, increasing administrative workload, and high patient demands. Continuous stress may lead to unproductive rumination that consumes energy and reinforces the experience of stress itself. Stress has been linked to certain diseases like migraines, obesity, muscle tension, and backache, cardiovascular disease, hypertension, and stroke. Stress can lead to burnout syndrome, reduced empathy, emotional exhaustion and depersonalization, depression, aggressive behaviors, and a reduced quality of life. This can impact our well-being and performance, as well as patient care, and it can ultimately lead to suicide. Despite the growing awareness that self-care is a key competence of healthcare professionals, these issues seem to be largely neglected in the process of medical education. So why practice mindfulness? Healthcare workers need tools to take a step back, see their actions from perspective, achieve a balance between work, study, and rest, and set priorities to maintain mental health and well-being and deliver effective healthcare. Mindfulness is correlated with lower levels of stress, anxiety, and depression. It's associated with better mood perception. It allows for the implementation of coping strategies for stress and the ability to perceive a given situation more effectively. It allows us to pause and respond to a situation rather than react to the situation. It helps us avoid the autopilot, which may lead to unwanted rumination of negative thoughts. Features of mindfulness correlated positively with providing calm, compassionate care, with resilience and clinicians' mental health, whereas stress correlated negatively with these characteristics. There has also been some documented function and structural changes in the brain, leading to improved emotional regulation.
So now if we jump into a more specific look into the literature, the first thing that we can do is take a look at the CMA website. Within their Physician Wellness Hub, they have a section on mindfulness in medicine, and they do specifically talk about one literature review that we'll pop into. So this literature review is from 2015, and it talks about specifically mindfulness within healthcare. We can see that mindfulness practices are very diverse. One of the most common ones that we talk about, Dr. Harmon mentioned, is meditation. It's been the most researched, but one of the more popular ones and a validated program is something called mindfulness-based stress reduction therapy, MBSR, which you'll see in the following slides as well. And like Virginie has been mentioning, there's many health benefits that have been identified, both psychological and changes in your positive affect and negative affect. But they've also been able to quantify these changes through things like vital sign changes, as well as serology changes. And an interesting one is actually increased antibody titers post-vaccination in people who engage in mindfulness. So how does mindfulness accomplish all of this stuff? The quick answer is we're not totally sure. The roots are in ancient Eastern and Buddhist traditions. The first time that it was brought into medicine was by the creator of MBSR, Jon Kabat-Zinn. And there is really no one clear and complete understanding of mindfulness and how it provides its benefits. One theory that's talked about in this literature review through multiple studies is this ability to be very conscious and aware of your current experience, or this thing called your mode of mind shift once you're conscious. So when there are stressors present, our brains and our thoughts can begin to ruminate and focus on the negatives. We start to avoid these thoughts or feelings, people, situations. Suddenly that initial thought or feeling, person, situation has grown in magnitude and concern, and all you can think about is how the next time you walk into work it's going to be negative, or the next email someone sends you is surely sent in a negative tone like the last one was. Through mindfulness, we can have a mode of mind shift. Instead of living inside of that moment, we come out of it and we observe it. We accept the current situation for what it is, and we move into an approach-oriented process. So for example, I'm feeling anxious in this moment. I'm worried about walking back to work after a difficult day yesterday. It's okay to feel this stress. This stress is outside of me. Anxiety is an emotion, a thought. I will release this feeling of anxiety connected to today because I don't know yet what today will bring. In this way, we can try to actively change our negative thoughts. In the same way, we can work on our interpersonal relationships. If we can stop and observe the moment, we can begin to avoid actions out of habit or impulse. So the other example was the email. I feel this email was sent to me in a negative tone. This person must be upset with me. I'm not going to respond to this email, and I'm going to start avoiding this person. I'm choosing this action because I feel like it's a negative interaction. I'm observing the stress I'm feeling in this moment. Once I've completed a mindful moment, I can recognize that I don't know my coworkers' thoughts and whether they're negative or not. What I'm going to do is I'm going to reach out to them and clarify their email and what our next steps together will be. All of that being said, if there truly is a bear behind you and it's not just the thought of a bear, please run. The next one we'll talk about is the most recent systematic review that we were able to find from 2020 that specifically looks at mindfulness-based interventions, or MBIs, on doctors' well-being, both positive and negative aspects. We're mindful that when we took a look at this with an instrument, I used AmStar2, it does give the systematic review a relatively critically low score. The systematic review itself included 7 randomized control trials, 3 control trials, 12 pre-post studies, 2 qualitative interview studies, and it looked at the effects of mindfulness based on the training content, the training format, and the education setting. So with respect to the training content, they used the formula or the way that Crane et al. Used. And what this does is it includes 5 different ways to create your program. So there's mindfulness theory, a little bit of what we're talking about, didactic information of mindfulness, again, what we're talking about, describing and being able to express self-awareness, self-regulation, and then some form of meditation practice. When we look at, when we look at the first element, so this training content, the only one that I summarized here for you guys is the studies that included all 5 of those elements. So 9 out of 24 studies did that. It was variable studies, as we can see. And each program that included all 5 elements was either the MBSR that we've talked about or MBCT, so mindfulness-based cognitive therapy. Both of these are validated programs. And the tough thing in terms of comparing these different programs and comparing the different studies is not all of them reported the same outcomes. When we take a look specifically at well-being outcomes, we do see that some of them were improved. So specifically, psychological and occupational outcomes were almost always improved in all of the studies. This includes things like stress, worry, relaxation levels, psychologically, and then occupationally, the 2 biggest impacts were in burnout levels and dedication levels at work. When we look at specific studies too, we can see that sometimes some of these outcomes are reported as unchanged, but they had differing levels of what they looked at for outcomes. So, for example, they had like a self-reported or a comment section on how participants felt that their well-being was. And often these would come out as unchanged. But when they looked at like organic things like vital sign changes, they would actually report that heart rate and blood pressure measurements after the sessions were improved. There were also performance outcomes that were looked into and interpersonal things. So like empathy towards your patients were improved, but safety impacts were unchanged. When we look at the training format, there were 3 things that could differ: the trainers, the delivery method, or time. So from a trainer perspective, certified independent trainers were found to be the most effective, the most validated, and the most successful in having the higher outcomes in participants. The impact for physicians themselves leading one of these sessions was that people did feel that they could connect with the trainer better, and they could feel that they had that peer support better. Now, in terms of the specific question about program directors, so there was a big paragraph on this focused on the resident participants, and they did find that when a program director led the session, it did make the participants feel that it was more difficult to present their findings or how they were feeling or respond openly to feedback. So what we would say, Dr. Harmon, is we would love an MBI, but maybe if you could just be in the background. From a web-based and group-based perspective, almost all of them did it in group-based, 21 out of 24 studies. And the 21 out of 24 studies had variable study quality versus the web-based, none of them were randomized control trials. And the group-based one, all of them reported improvements in positive and negative wellness indicators. So these are things like empathy, mental health impacts, resilience, quality of life. And then from a time perspective, it could be very short or very long. So short term, it could be 1 session to 2 days. All of these improved positive indicators short term, but there was no follow-up for any of these studies. From the long-term perspective, there was only 1 study. It was 9 months long, and it showed a lot of improvement in occupational wellness indicators. So things like burnout levels, empowerment at work, dedication, satisfaction at work. That being said, there were no changes noted to psychological and interpersonal indicators. However, the study really was focused on peer support and coworker collegiality and connecting people together. And then almost all of the studies were medium term, so 2 to 3 months long with weekly sessions. And all of these reported improved positive and negative indicators, both acutely and at their follow-up, which occurred at different times. And then the last way that they split it up was, did they look at residents or did they look at staff physicians? So when they looked at when they looked at residents, there were residents from several specialties. They could either sign up on a voluntary basis in some studies, or some studies would tell them that they could put it in their portfolio. There were no positive indicator changes in psychiatry residents for some reason, if anybody out there is in psychiatry. The mindful thing about this is that all the studies that looked at psychiatry residents, interestingly, were small studies, so not as evidence-based. When we looked at randomized control trials or control trials of medium-term length sessions for other residents, we did find that there were especially changes in psychological outcome indicators and occupational outcome indicators. And interestingly, the residents that started off with a poor baseline of well-being were more likely to have more improved well-being indicators. So things that went into considering what a poor baseline was high levels of exhaustion, high workloads. Do residents recommend it? Yes, they very much do, especially for those with poor baseline well-being. And then when we look at staff physicians, so again, some signed up on a voluntary basis, some were given continuing education credits. They looked at family doctors, but also hospital specialists. They both had improved outcomes in all of the studies in various areas. And then the biggest thing that they found in the group-based MBIs was that physicians who had solo practices really appreciated the peer support that came from the session. In terms of our benefits, the systematic review split this up mostly by looking at the qualitative studies and the areas where participants were able to give open-ended feedback. And the two biggest areas or key findings that they saw were self-understanding and understanding others. So you can think if you're improving your self-awareness and you're starting to recognize your triggers of stress, you can improve your ability to recognize that automatic pattern or that autopilot that Virginie was talking about, and then practice making deliberate choices in transitioning those negative thoughts into positive actions or supportive actions. So people found that they were able to better set priorities, set limits, and ask others for help when needed. With respect to understanding others, there were self-reported improved abilities to accept one's own emotions and others' emotions. So ultimately that led to them being able to see their patient's perspective and their coworkers' perspectives better. And so that will translate into a subjective improvement in improved doctor-patient relationships. The challenges of MBIs, I'm sure people are thinking about it as we're listening about this. Where do we fit this in? How do we have the time to do this? So time was absolutely the biggest challenge. And one of the words that kept coming up in multiple studies was this guilt component. So do I participate in this session or do I get things done at work? Do I participate in this session or do I get home to my kids? And when we looked at where can we best fit these sessions, do we do protected work time or do we do home? Actually, they found that the best place to do it was at home because it ultimately, through self-reflection, taught these participants to improve your work-life balance by prioritizing what's most important to you. From a feasibility perspective, so, okay, how do we do this? How do we incorporate this into our daily life then? Through multiple studies, residents started to do it in daily brief exercises. So an example is just like mindful breathing before walking into an OR. And then many studies actually showed that participants started to do it together as a group. So right in the morning before clinic or right before rounds. And overall, participants did feel that mindfulness was worth finding that right place and time for a session.
All right, so now let's get into, from a more practical lens, how we as physicians and other allied healthcare providers can bring mindfulness practice into our daily lives in a way that's positively impactful. So I think firstly, in order to incorporate a change in our lives, we need to find a personal motivator that incentivizes us to put forth effort until that change becomes habitual. In other words, we need to find our why. Over the last few years, a word that's become increasingly common and unfortunately something that may be personally known to many here today is burnout. And as we know, burnout is a work-related entity that involves emotional exhaustion, depersonalization, and a reduced sense of personal accomplishment. A 2021 CMA survey showed that burnout was significantly higher among respondents in 2021 compared to those in 2017, with 53% of respondents reporting this versus 31% in 2017. And they found at this time that both depersonalization and emotional exhaustion had roughly doubled. The Canadian data has also been seen in other healthcare landscapes, like with our neighbors in the US. And why does this matter so much? It matters because there really are downstream consequences for physician health, patient care, and the system as a whole, and some of which are shown in this image here, taken from a 2018 Journal of Internal Medicine review article. And I'll just highlight them because I do think they are quite important, and I think maybe through these we can find our why. So with respect to patient care, we can see that burnout has impacts in terms of lower quality care. There's increased medical errors, longer recovery times, and lower patient satisfaction. With respect to physician health, we see higher rates of substance abuse, higher rates of depression, suicidal ideation, poor self-care, and increased rates of motor vehicle crashes. And then with regards to the system as a whole, we see reduced physician productivity, increased physician turnover, less patient access to care, and increased costs. So having seen that burnout can have negative downstream effects on both personal health and patient outcomes, what can we do about it? We know that excessive workloads, administrative task burden, inefficient processes, lack of control over our own work lives, organizational structure or support that's suboptimal, as well as I mentioned, lack of control, all lead to burnout. And then when we look at these things, we think, how can we make a difference? And looking at them, sometimes it seems like insurmountable systemic problems that may be difficult to combat on a personal level. So perhaps instead, when we make that first step of personal change to work against these things, we can start by including mindfulness into our daily routine. There is a small body of literature looking at workplace interventions that can lead to decreased occupational stress in healthcare workers. And a Cochrane systematic review found that mindfulness can reduce stress with effects similar to that of physical relaxation. But the good news is it's often more accessible. So let's get into realistic ways that we can bring mindfulness into our busy lives. Firstly, as some of you may be familiar with, there are app-based interventions such as Headspace and Unwinding Anxiety. And just to preface this, we have no affiliation with either of these. But so Headspace provides a variety of guided meditations to support anxiety, stress, just being mindful, and also to support sleep. And there is a small body of literature looking at these. So an RCT in the US looked at whether 10 to 20 minutes of daily mindfulness meditation using Headspace for 30 days could decrease perceived stress and improve well-being for medical students, and found significant improvements in both of these domains. Unwinding Anxiety is an app that helps you identify your habits and your anxiety triggers and use in-the-moment anti-anxiety tools in mindful moments. There also is a study with respect to this app, and it was a non-randomized pilot study of US physicians with anxiety, and found that use of this app was associated with a significant decrease in anxiety, as well as emotional exhaustion and cynicism, which were used as markers of burnout.
Okay, all right. So I know we've already touched on the concept of mindfulness-based stress reduction therapy, or MBSR, already in this presentation, but we want to take a little time now to talk about this therapy in a little more detail. So what is MBSR? Well, it's a standardized way of teaching mindfulness and meditation techniques. So we first started to see elements of it in the late 1970s based on Buddhist techniques that encouraged the development of both mindful and non-judgmental awareness. But more interestingly, it was not brought specifically into the medical field until more recently in 2003 by Kabat-Zinn. And even more interestingly, there is a meta-analysis that suggests that healthcare professionals may benefit more from MBSR compared to the general healthy population. The goal of bringing MBSR to medicine is that it really does strive to reduce stress within the medical practitioner and therefore improve his or her psychological well-being. The practices offered during MBSR are based on the practices of meditation, and the course itself is a combination of theoretical explanations, formal training practices, and moments of dialogue. So what exactly does an MBSR course look like? Within the literature, the MBSR program is a well-established structured format that is frequently used as a standard format in teaching mindfulness skills. However, this being said, in comparing the various iterations of MBSR discussed within scientific studies, there is certainly variability that exists between different implementations of MBSR, with the understanding that, of course, there will be preservation of its basic structure and core elements. Classically speaking, an MBSR course runs over an 8-week period and consists of 2-hour sessions weekly, daily home practice, and a 1-day retreat. MBSR courses are offered in both online and in-person formats, which increases their accessibility. The literature suggests that MBSR programs have effects on burnout, stress, and empathy skills. So let's look a bit more carefully at the literature. So in the literature, it's been looked at in a reasonably limited fashion, but it has been looked at specifically in the medical field. So I want to go ahead and talk about 2 selected papers a little more. So the first is a narrative review by Pohl and Guerin 2021, where they provided MBSR training for medical students. So this review included 9 papers where medical students underwent MBSR programs lasting anywhere from 7 to 10 weeks in duration. The study went on to show increased measures of psychological well-being that was preserved at 6-year follow-up, as well as increased self-compassion that was preserved at 6-month follow-up. The study also showed immediate improvements in stress levels and psychological distress after completing an MBSR program, as well as reductions in self-reported depression and total mood disturbance. Several of these papers assessed empathy, but their results were quite mixed. And the one paper that looked at burnout showed no effect of MBSR. So the authors actually hypothesized that burnout is usually the result of long-term stress and depression, and stress and depression are usually the first variables that we see changing in these studies. And this specific paper didn't include any longitudinal follow-up, so perhaps that would account for our inability to see effects on burnout. Limitations in this review really included the variation in MBSR practices across the papers, as well as heterogeneity of the outcomes assessed. So even when papers assessed similar outcomes, sometimes they would use different outcome measurement tools. And there's also limited generalizability of the results to all medical students, because some students were voluntarily enrolled in the program and others underwent a mandatory participation. The second paper to discuss applied MBSR is more generalized in the sense that the authors recruited among healthcare professionals in various healthcare centers and primary care settings. Their total sample included 29 people, and within the healthcare professionals included doctors, nurses, and psychologists. This study showed significant positive benefits, including 35% reduction in stress, 30% reduction in rumination, and 20% decrease in negative affect. These benefits were preserved at the 3-month follow-up mark, and attendance at MBSR sessions in this study was quite high at 92%, but this was confounded by many factors, including financial compensation that participants received during the study. And this study in particular was notably limited in its lack of a control group.
And maybe after hearing all of this, you're thinking that using an app or signing on to a commitment in the form of a course are just not up your alley at the moment. So what if you just have a minute? There are simple ways you can practice mindfulness in this time. And I will say with the caveat that most of these have not been backed by evidence because they're really not standardized practices. So first idea would be really paying attention to your surroundings. So rather than letting all the thoughts in your head kind of run wild, experience your environment via your senses. Think about what you're eating. Why does it taste the way it tastes? What about it smells good? And what does it look like? Other thoughts could be doing mindful minutes. This can be as simple as recognizing when you're having negative thoughts and sitting down, taking a deep breath with your eyes closed. Take a deep breath in and out and focus on what the breath feels like as it moves in and out of your body. Another helpful practice can be the practice of gratitude. And this can either be when you're feeling down or it can become something habitual in your day-to-day life. What can be done with this practice is writing down a couple of things that you're grateful for in your day-to-day life, or if work is a place of hardship, perhaps finding things that you're grateful for in the workspace. This way we can remember what we like and appreciate even when times are tough, as we've seen over the last couple of years. A final suggestion is making your commute mindful. And I find this can be a good dedicated time between the stresses of work and between whatever awaits you at home in terms of commitments, where you have a few minutes of protected time, perhaps longer. And if you turn off the radio, silence your phone or other interruptions, you can really focus on your surroundings, your senses, and your breath.
So we hope that our presentation has been insightful so far, but we do know that sometimes the best way to understand something new is to see it in action and try it out for yourself. So we wanted to take this opportunity to share with you a mini meditation video from Headspace, which is that app that we've previously mentioned. We are not sponsored by them, but we just are very excited to show you how accessible it can be because many of their videos are available for free on YouTube, for example. So for those of you who have done mindfulness before, we hope that this will give you a chance to reset before launching into the rest of your day. And for those of you who haven't done mindfulness before, we hope that this will be a bite-sized introduction. Sometimes it can be challenging to turn off all the thoughts in your head. But mindfulness, just like medicine, takes practice, and it's a skill that requires time to be developed. So we hope that this will just be the start of your mindfulness journey.
So wherever you are right now, I'd just like you to just take a moment to get comfortable. Doesn't matter whether you're parked in a stationary car, sat on a train somewhere, maybe you've just arrived home, maybe you haven't left work yet. Whatever it is, wherever you are, just taking a moment to sit comfortably. Don't have to be fully upright, but at least sat in a position which will allow you to find that balance of focus, relaxation, sense of ease in both the body and the mind. And as you sit there, just take a couple of nice big deep breaths, breathing in through the nose and out through the mouth. As you breathe in through the nose, sense of taking in fresh air, the lungs expanding, body expanding. As you breathe out, sense of letting go of whatever been going on for you today. Feeling the muscles in the body soften as the body exhales. Just a couple more times, taking deep breath in through the nose and out through the mouth. And the next time you breathe out, if it feels more comfortable, if you're in a place where it's easy and safe to do so, you can just gently close your eyes. And as you sit there, just enjoy that initial sense of having just put everything down, having left everything behind. And just that feeling of being present again, noticing the sensation of the body pressing down against the seat, the chair beneath you. Just that feeling of being grounded, the feet on the floor, the hands and the arms on the legs. And as you sit there, just taking a moment without opening the eyes to just notice the environment around you as well. Maybe it's the sounds, different smells. Maybe it's movement, maybe it's stillness. Maybe it's the temperature, maybe it's the wind if you're outside. But with the eyes closed, just becoming more familiar with the space around you. And as you sit there, starting to notice how the body feels. So very often as we go through the day, we accumulate tension, just noticing if there are any obvious areas of tension in the body. Not doing anything to them, they'll unwind on their own. We approach them in the right way, but just noticing how the body feels. Allowing any tension to come to the surface, knowing that's a good thing. Allowing any tiredness, any feeling of heaviness to come to the surface, knowing that that's a good thing. So in letting go now at this stage, we give the body and the mind space to be more alert, more awake after the exercise. And just starting to notice the breath now as well. The breath is also a good indication of how we're feeling in both body and mind, and without trying to change the breath in any way. Just noticing whether the breaths are long, short, deep, or shallow. You can just gently place your hand on your stomach if you find that more comfortable, easier to feel that movement. And again, even though thoughts may still continue to pop in, perhaps about what's happened during the day, where you've just come from, or maybe even jumping ahead for what's to come. Each time you see the mind wander off, just letting go of that and coming back to the present, that feeling, that sensation, the movement of the breath. And then mentally now, you're just going to imagine that the body, the mind is taking a shower, that any tension is being left behind. Just like you to imagine a warm ray of sunlight just shining down onto the body. You can imagine it shines down on your back, your chest, on top of your head, wherever feels comfortable. And it's as though it begins in one place, but it expands outward in every direction. And as it does so, it just melts away any tension. You can even kind of work systematically down through the body, just watching, feeling any tension melt away. Mentally, we leave those thoughts behind. Physically, we let go of whatever's accumulated during the day. It expands outward in every direction, all the way to the end of our fingers, toes. So it's as though the entire body is not really separate anymore from that idea of sunlight. There's just a sense of ease, warmth, sense of having reset both the body and the mind for whatever is coming up next. And in your own time, when you're ready, you can just gently open your eyes again. So wherever you are right now, and just like you.
All right. So thank you everyone for meditating with us, and we hope that everyone feels a little bit more mindful after that. But before we go, we want to leave you with a few concluding thoughts. So we've learned today that mindfulness can help reduce stress and anxiety in our lives and overall improve our mood and emotional regulation. This is particularly helpful as we work in a high stress environment in which we often find ourselves exercising our emotional regulation skills. The literature is encouraging in that it suggests that mindfulness can have significant benefits for us as healthcare workers. And remember that mindfulness can look different for everybody. There are structured formats available, such as the MBSR, but mindfulness strategies can just as easily be incorporated in your day-to-day activities. Almost anything can be a mindful activity if you just put your mind to it, pun intended. And so that concludes our presentation for today. Thank you everyone for your participation and attention. We are very happy to take any questions or comments at this time.
People think of questions, I'll direct you to the comment that Toby put in the chat, that Dr. Odson put in the chat. She says, thanks for an awesome presentation. Apologies that she had to head out, but pointing out that the Faculty of Medicine Wellness used to offer MBSR training in a condensed format for physicians. And so if there's interest, she's happy to look into this, and not just at the resident level, but faculty or any other group that's tuning in today. Maybe I'll ask a question since there's opportunity. Thank you. Great presentation. When they're doing these studies and they're looking at the effects of mindfulness, what do they tend to use as the comparator? Are they usually comparing mindfulness to giving people 10 minutes and telling them to do whatever relaxing technique they think of, or do they tend to compare to something else specific?
That's a great question. So thank you for that. I'll speak specifically to the articles I spoke about, the MBSR program. So in the review, some of the studies they looked at had control groups and some of them didn't. In terms of control groups, the most common one that was used is essentially people who did not undergo an MBSR program for training. The papers also do talk about something called like an active control group. Although it wasn't utilized in any of the studies, they do talk about the potential value of an active control group. And it would be something similar to what you had sort of mentioned there, Dr. Harmon, without like an actual program per se, but also lack of a intervention at all, but like just giving people that same time, the daily home practices and all of that, but without a structured format. So none of the papers we've looked at in that systematic review had an active control group, but I think that it would be something very valuable in terms of future studies.
All right, thanks. Do you see the question in the comment from Emanuela Ferretta? She's asking, did any study look at introverted versus extroverted personalities? And was there any targeted suggestion for different personalities?
Yeah, that's a great question. Personally, in my review of the literature, I didn't see anything specific to personality types, and please feel free others to chime in if you saw anything, but I don't think any literature exists that addresses that. It would be an interesting question, though, to see, if your baseline disposition does impact the way in which this affects you. Yeah.
I'm going to quickly pop into and say, within the systematic review, there were some randomized control trials, Dr. Harmon, that did do that for the control group. They just gave them like an hour of free time in their clinic or in their hospital a week, and then they could do what they liked with that hour.
Thank you.
There's a question from Sophia Hirko here that she might need to clarify because I'm not sure what one of the words is. But I'm curious to know if you know of any study looking at Balint group and impact on physician wellness. I don't know what Balint group is, but maybe one of you have come across this.
So do you know what Balint group is? No, so it's, generally a group of physicians, although it's been done with medical students and residents as well, where, and it's a structured format where a case is presented and then the participant will take on the role of various team member and share, their emotion, questions, reactions to the situation. Then there will be a reflection part where the case presenter will, sort of address some of the thoughts that came through the not role play to a certain extent, and then there is sort of further reflection. So in a way, it's to me, there's some elements that allow self-reflection and dealing with cases. And I was just wondering, there's somebody who's talking about Balint group there, is training to Balint group leader. Okay. So yeah, I think to me that I was just curious to know if there was any study you saw with the impact on wellness of physician. I know there's some being looked at for a medical student. And maybe Aaron will have the answer.
I think one of my takeaways from your presentation is that mindfulness isn't sort of an either or thing where there's a bunch of different relaxation techniques to choose from. So you could do yoga, you could do meditation, you could do deep breathing, you could do massage. It really seems like mindfulness is an adjunct that you can be doing while you're doing these things. I can turn my regular yoga into something a level above if I add mindfulness to it. The floor is still open if anyone else has any other questions that you can either put in the chat or you can ask out loud. If not, then I will thank our presenters for taking the time to go through this with us and see you guys around on the wards and in other places.